Today, I'm going to show you how to save tons of time with your patient notes and stay in your treatment brain instead of your thinking documentation brain, and make sure that you're not spending your weekends documenting. I'm going to show you about ComprehendPT and how it can save you a ton of time. So look, my name is Dr. LeBauer. I'm a physical therapist, business coach, father, former semi-professional cyclist, and I've been using ComprehendPT in my practice for the last probably 3 or 4 months. It saved me a ton of time. I started treating patients again recently, and one of the things that is really hard for me, I take notes, and my notes are easy. I use Google Docs and Google Drive, and I have to go from treatment brain to thinking brain, and that's really hard, and I've got ADHD, so sometimes I'll put it towards the end of the day, and I won't get my notes done. I started using ComprehendPT, and I can basically get my notes done in just like 1 or 2 minutes. Without thinking about it, I can do them at the end of the day because it has lots of great information and stores information. So this is an AI HIPAA-compliant documentation system. It's going to save you a ton of time. Let me show you a little bit about how it works and how I'm using it. Okay, so super simple. I'll put me over here. You got home, patients, visits, template, library, etc. I mean, all you really got to do is you come up here and you press new visit, and you press record, and the patient walks in the door, and you chat, and I can pretend like I'm chatting. I'm going to say, hey, John, how you doing today? John goes, oh, I'm doing fine. I say, John, what progress have you made since our last visit? And John will say, hey, I've been doing much better. I can lift heavier without my knee pain, and the last few sessions of therapy have been really helpful. And you go, okay, great. And you ask him some other questions, etc. And let's see, I can stop it, and then you'll see there's a little, it may not be recording. Oh, there's a little transcription, okay? And if I click comprehend, it will hit some notes. So watch, and I can come out here and I can do copy responses only, and I'm going to open up a blank docs window, and I'll show you what happens when I paste it. Boom. Patient reports doing much better since last visit. Able to lift heavier weights without knee pain. Last few therapy sessions have been helpful. Objective review, lifting exercises. I mean, it starts making some things up a little bit, like mobs. I didn't do knee mobilizations. It's just guessing based, but I'll show you how we update that, and it gives me a next visit. Here's what I want to work on. So what I will do at the end of a session, and I'll show you what a real session looks like. It'll record it, and I can even come in, and I can resume and say, okay, I did dry needling to the right quad, left gastroc, and I did banded goblet squats. Home exercise is the goblet squats plus deadlifts. Next visit, I want to make sure that we look at his squat pattern and right knee mobility. I can add a little note to it. I can hit comprehend, and you'll see how it's going to update some things. And then I can go down here and do copy, and then you'll see what happens when I paste it in. Again, it's updated. So you can see the objective section has updated it. Okay, how does it know how to do it? It's because I have created a template. There's my template library. Well, there's a whole library of templates, and it integrates with almost every EMR out there. JNAP, IntakeQ, PT Everywhere, etc. Let me see, where's my template settings? I went to the new template builder, and I created an Aaron's Daily Soap Note based on how I like to do it. Let's see. And then so you can see under here, I can create instructions, but what I do is I give it samples of my notes, and then I can generate instructions. And it starts to spit things out the way I like it. Objective, like I came in and added this. If information is not found, do not include an answer. However, it will start to learn from you, especially if you use the ComprehendPT Chrome extension, and you're doing it in something like IntakeQ or PT Everywhere, WebPT, etc. It'll learn and improve the notes. And then, let's see, there's a template library. Okay, you can use one of theirs, super easy. You look, I'm doing cash, so it's super easy. I just wanted to keep it the same. I can go back and see visits October 4th. Here's the time. It doesn't have any patient names in here, but I can match it up with my patient names, or I can add patient names. You can add patient visits. This comes with some integration, but really the easiest thing is just to come in here. Every time I hit a new visit, before a patient, hit a new visit, hit record. And then at the end, I do copy responses. And a lot of times I'll go in and I'll just update it a little bit. And as you're updating it, it can learn. So here's the last visit I did. There's no patient information in here. I've got like the transcript, the subjective, and I would hit comprehend. Let's see, it didn't like it before because I turned off my computer, but you can see it comprehended it, and I can do copy responses, and this is the sample copy of the last visit. There shouldn't be any patient data in here, and I press it, and boom, here's my visit. Patient reports seeing progress each week, despite some speed bumps. She might have said that wearing different shoes sometimes leads to regret pain. Like, that's interesting. So yeah, I regret wearing certain shoes, okay? And I can go in and update these things or change it, but I don't have to really think. I can go, oh yeah. And this came, a lot of times the objective is hard, like what did I do with my hands when I'm quiet? And I can go in and update I can update the transcript just like I paste it in, or I can just kind of dictate it in. And I get a little assessment and a plan and next visit. And there's some improvements I want to make to the template. I just haven't had much time to, and I don't really. It just saves me a ton of time already. So it's super simple, super easy. If you want to check it out and you use the link below this video, you'll get a 50% discount, I think, off the first month if that special's still available. And check it out. Try it out for your clinic, for your PTs, and let me know what you like most. Comment below what's most helpful or insightful for you. All I know is that this saves me a ton of time every week. Even if I go a day or two without doing notes, I can come in and I can go here to chat and say, what did I recommend for exercises? And it'll spit it out. Boom. Okay, and I can say, what did the patient say about wearing different shoes? Patient mentioned wearing different shoes sometimes leads to regret and causes discomfort. Okay, great. Overall, how is the patient doing? So I can ask questions like, let's say I forgot, and it'll do this all based on the transcript, which, like I said, this is all a HIPAA-compliant platform, and it's pretty awesome. So I can come and add new things to it if I want to update it, etc. Check out ComprehendPT AI. It is really awesome. Like I said, you can go into IntakeQ, PT Everywhere, JNAP, etc. It should integrate with it, or you could use this like Chrome extension